So doing cardiac surgery is risky business. I paid up to $46,000 a year for malpractice insurance because patients die and they're mad. Families are mad. By the time I finished practice, I was paying down to only $18,000 a year, 22 minus certain benefits that they gave me, and I never spent a day in court from being sued. I got sued maybe once or twice, but and I attributed that to the fact that I would explain the risk carefully to my patients before surgery. Most of the surgeries that I did had like a 1% mortality rate. Coronary artery bypass, valve replacements, that sort of thing. Even aneurysms, big aneurysms here and there. And I would explain to them that the risk of this operation was 1%. And I'd explain that I know you think that sounds like almost nothing. It's almost no risk whatsoever. If 1% of the airplanes that fly commercially today were to crash, 500 airplanes would crash today because the risk is so tiny that there are 50,000 airplanes that fly every day. If 1% crashed, 500 airplanes would crash today. And if you had to go to New York tomorrow, you'd walk. Today, I think it's like 80,000 flights a day.
Yeah.
So 800 airplanes would crash. And I would look at the patient and say, I'm not telling you this to scare you. And I'm telling your family who's sitting over here, so if things go south, they're not going to be mad. Because it's a risky business. Now, there's a tendency, I think, a lot of times for doctors to say, oh, well, it's only a 1% chance that you're dying. That's nothing, it's very tiny. And then when it happens, it may be 1 in 1,000. But if there's 50,000 flights a day and 1 in 1,000 died, that would be 50 planes would crash today. And I'd say if 500 airplanes crashed today, and you had to go to New York tomorrow, you'd walk.
Yeah.
If 50 airplanes crashed today, and you had to go to New York tomorrow, you'd walk. Surgery is dangerous business. Well, it served me well for my practice, and I tried to be very honest with them, and I think it paid off.